very good morning to everyone who's watching us live from various parts of the globe. My name is Ruben Lobo, and on behalf of Team DentistChannel.Online, I warmly invite you to the fifth day of the biggest virtual implantology event of 2020, the world's first virtual Implant-Expo, organized by your very own company, DentistChannel.Online. It's a beautiful morning, and like yesterday, we are starting once again with a power-packed session. Ladies and gentlemen, the last 4 days have been amazingly beautiful, and we thank you for the beautiful response that all you lovely people have given us, and for all the blessings, supports, and the well wishes that you all have given us. Ladies and gentlemen, once again, today morning, we have a very special speaker, a person who is once again a name synonymous in the Indian dental fraternity. Most of you all know him. Most of you all know him as the digital dental guide. But still, a short introduction about our next speaker for today, Dr. Sudhir Yadav. Dr. Sudhir Yadav is a senior dental practitioner based in Gurugram, India. And he has been practicing since the last 20 years. His field of interest is oral implantology, which he has been actively pursuing since the last 12 years. He started his journey in implantology under the able guidance of Dr. Harald Schild from Switzerland. He further came in contact with Dr. Shadi Daher from Boston, Dr. Yong Seok Cho and Dr. In-Seok Jeon from South Korea, and Dr. Ofir Framovich. Dr. Sudhir Yadav has persuaded the all-on-4 course by Dr. Paulo Malo from Portugal. He is a trainer and analyst in 3-shape intraoral scanners and Lyra, the chair-side milling machine. In his long span of career of 20 years, he has traveled in various countries and has attended numerous courses. Countries include Germany, Portugal, Denmark, France, Dubai, Israel, and Malaysia. He is a member of the IDA, the DPFI, the MAOI, the MISOI, and the MICOI. He has held several positions, and one among them was the president of the Indian Dental Association in the year 2013, when he was the director of the Adonis Dental Private Limited. Presently, he holds the position of the director of the following companies and organizations: the Indian Academy of Digital Dentistry, the IAD, the Gurgaon Dental Academy, the Muskan Dental and Implant-Expo, and 3-shape intraoral scanner. Ladies and gentlemen, starting the first day of the world's first Implantology Expo with a bang, and presenting to you Dr. Sudhir Yadav live.
Am I audible?
Sir, request to mute your other device, please.
Okay. Hello. Now
Yes, you're audible. Perfect.
Good morning, friends. My name is Dr. Sudhir Yadav, and I'm a practicing dentist in Gurgaon since 1998. And I'm director in Indian Academy of Digital Dentistry, who's teaching the Indian doctors about the digital dentistry. And I'm director in Gurgaon Dental Academy, Muskan Dental Clinic and Implant Center. And our latest venture is known as Dental Avenir, which is a completely digitalized clinic. So we are using here intraoral scanners, chair-side milling machines. So it's state of art. So first of all, I would like to thank DentistChannel.Online to provide us a platform to share our views about the digital processes on behalf of Indian Academy of Digital Dentistry. And let me just give you a little brief about IAD, which is known as Indian Academy of Digital Dentistry. in which we are conducting our lectures about digital dentistry all across India. We have conducted lectures in Gurugram, Delhi, Aurangabad, Mumbai, Pune, even in Dubai also. So we are teaching about how to do intraoral scanning, chairside milling machine, about the aligners, about the computer guided surgery, and so on. So these are a few pictures which we have conducted lectures in different areas of India. So dear friends, especially after the post this pandemic, our government is emphasizing over digitalized things. So right from your payment options, your money transfer, your entertainment channels, your social media, your plane tickets, your train tickets, your hotel bookings, everything is digitalized from pin to plane. If everything is digitalized, then why not dentistry? So I think it's time that we should take a next level of dentistry, and we should start practicing digital dentistry, so that it will be a completely paradigm shift. Since I'm using this digital dentistry from last 3 years, and I found that my work is getting better day by day, as I can see my work directly on my screen, and if there's any some problem with my preparations or something wrong with my processes, I can check it there, then and there only, and I can rectify it there only. I don't need to call the patient again and again. So there are a lot of things which we can do with the digitalized dentistry. So like for the restorative, we can go for inlays, onlays, crown, bridge. In ortho, we can go for aligners, implantology, and orthodontics, and so on. So today we basically focus on digital implantology. But if you see implantology as a whole subject, we can do it in a 3 ways. Either it should be a complete analog implantology, a complete digitalized implantology, or it's a hybrid implantology. So first of all, we'll discuss about the analog implantology. It's like placing an implant with a free hand. So this technology is totally based on the 2-dimensional images, like we take the radiographs and then we place the implant with a free hand, and then we'll make the impressions after a few months. Then we pour the cast, mount it, make a die, wax up, invest, and get the final processes. But during this total process, if you find there are some errors, especially many times when I place the implant, I found that if I could place the implant 3 degree or 5 degree here and there, or a little bit here and there, it will be a best placement. So through digital implantology, we can achieve it, because before placing the implant in the patient's mouth, we do it virtually in our computer, and then we exactly replicate in the patient's mouth. And during making of impression and pouring a cast, there's an expansion and shrinkage. So there's a lot of problem which is getting created. So get rid of these kind of errors. I think we have an answer called digital implantology, in which after achieving a .stl file, that is a 3-dimensional files of the patient's mouth and the bone, we virtually plan the case in the computer and the software, and then these surgeries are replicated in the patient's mouth. And whether we are going for an immediate restoration or a delayed, accordingly we scan the case, and then after planning, we do the CAD, that is computer-aided designing, and then we'll print or mail the case. So if we talk about the hybrid implantology, in hybrid implantology, we place the implant freehand and depending on the 2-dimensional radiographs. But at the time of making an impression, we have 2 choices. Either we can place a scan body in the patient's mouth and directly scan the mouth through the mouth, or we can take the normal impression and put a lab scanner in a model, and then we scan it, and then we do the CAD, and then with a print or mill and send it to the clinician. So it depends on you, and accordingly, what kind of armamentarium you have, you can decide upon. So today we will focus on basically on digital implantology. So to understand this digital implantology, we need to understand the workflow, which is very important. So first thing, we need a three-dimensional data of the oral cavity that can be achieved with the intraoral scanning. We get either DCM file or a .stl file. And latest we have a PTL file also, but normally we work on .stl files. And then we need a .stl files of either we can use the raw data file. These are raw data files. We get it through the CBCT. These are the three-dimensional files of a bone. And these files, both files, the CBCT and intraoral scanning files, are used in software, and we do the designing directly, virtually in the computer. And here we can mark all the vital structures, as you can see in this picture, that you can actually mark nerve or any, in fact, any vital structure you can mark, and you can choose the width of the diameter, the length of the diameter, and they create one of the safety measures that it should not come in contact with any vital structures. So here, through this kind of technology, we make sure that our surgery is 100% flawless. And this is how we create our, started designing our cases. And exactly these virtual implantology is replicated in the patient's mouth through the clinician. So depend post-surgery whether you want to go for an immediate restoration or a delayed restoration. So if you want to go for an immediate restoration, you have to decide before doing the surgery. So at the time of virtual designing, we can decide upon whether we have a sufficient bone, thickness, everything. So we can ask the designer, or if you're designing it yourself, it's excellent. And you can decide your temporary crowns, your customized abutment with jig and surgical guides and implants. Everything is decided before going for a surgery. But if you want to go for a delayed restoration, there's no problem. You can use the regular procedure, like for second stage surgery, you put a gingival formers, then you make an impression, either open tray or closed tray technique, or you can use the scan bodies also if you want to go for a digital technique, and then send the labs to this data to the laboratory. So this is the immediate restoration which we have done for the anterior case. So for delayed restoration, we can use scan bodies. These are the lab scan bodies. So in this lecture, I would like to tell you a little about scan bodies, that what are exactly a scan bodies. Scan bodies is a device that tell you about the orientation and the location of the implants. Plus, we can also know the level of the bone and the thickness of the soft tissue also. So it gives you a complete information. So different company has a different type of scan bodies. So as I said, it is a device which gives you the information about the orientation and position of the dental implant and a soft tissue. So this is a small video which I'm sharing you how to select the case in the 3Shape software and to design your abutment. So whenever you want to go for a abutment, what you can do is You can select the patient's name and now you select the tooth, and after selecting the tooth, you select the kind of abutment you want to go for, whether you want to go to a square or a symmetric. Then you select the kind of what kind of you're using, the company, whether it's a regular or a mini, it's a regular platform or a narrow platform. And you can select the restoration also, what kind of material you want to go for, even the shade. Yeah. You can take a pre-preparation scan also, so that you can see how the things are before the preparations. Now, when you start doing scanning, you have to do a 4 scanning. First is the lower arch, then lower arch is the scan, the upper scan, and the bite or the occlusion. For scanning implant, you can do it in 2 ways. Either you remove the gingival former, scan the area, and to keep the soft tissue in a retracted position, you have to lock. This will freeze the emergence profile and it will remain retracted. There's certain strategy through which if you do the scanning, it will be done in a best way. You don't have to repeat again and again. As you can see on the left side of your window. Don't be in a hurry, do it nicely. Then mark the tooth. The second option is you scan the mouth with a gingival former, and then you trim the area around the gingival former with the tool which is known as trim and software. Then remove the gingival former, and then again scan the implant. The 3-shape interval scan tries 3 scan up to 10 mm inside the implant. Then analyze the case. This is a model view. The tooth or preparation. Now you can place the scan body on an implant and then you can restart your scanning in the particular area. This is a scan body. Different implants are different shapes. Like I use scan bodies provided by Dio Implants from Korea. Now we'll scan the upper arch. You can, on the left side, you can see the strategy. Always start with the molar because it has a larger surface and you can scan it immediately. Now we need a occlusion. So after removing the scan body, ask the patient to bite and then you scan. It will come in contact automatically. If it doesn't come, you can do it manually also by placing 2-point articulation. Now here you can select the shade, your contact. Now we are analyzing both the models. We can check the bite, we can see the shade. Now we go to the send page and we can check the order form. After checking all the details, our case to the laboratory. Thank you. So these are the different kind of scan bodies which I'm talking about. So as I said, I'm using scan bodies because it acts as a hearing abutment also, and it acts as a scan body also. So that's why they call it scan body. So they have an adapter also, but since I'm using a 3-shape Trias 3 scanner, it can scan the scan body also. There's no problem. So once we have scanned the scan bodies, these data is transferred to the laboratory, and the laboratories, what they do, they receive all the information through the implant library, as you can see on the screen, and they put this library on the scan body, and they give you the complete information about the implant, their orientation, their position, soft tissue thickness, everything. So we'll discuss some few cases after doing my presentation. So this is the kind of scan body library. So now we'll talk a little about the scan bodies. So they have different diameters of scan bodies. For molars, they have different sizes and diameter. Depending on the thickness of the soft tissue, they have different heights also. From incisors, premolars, molars, they have different kind of scan bodies. And like for incisors, they have different, and they have certain numbers. Like if you see the first case for the incisor, it's 661. For 6 means the diameter of the scan body. Another 6 is the height of the scan body, and 1 is the soft tissue color, thickness, height of the soft tissue color. For premolars, it's 561, again the same thing. And for molars, if you see, it's 662. It means 6 is the diameter, another 6 is the height of the scan body, and 2 is the gingival height. So according to the implant and the area, we can select our scan bodies. So they come in different heights also, right from 4, 6, and 8, even 1. So these scan bodies, they replicate or the internal connection of the implant. If you see this first picture, second picture, and third picture, they are coinciding with the internal connection of the implant. So now we'll discover the digital processes, right from customized abutment to the Rising Star digital abutment. We'll go step by step. So as I told you that after placing scan bodies, in the first picture, as you can see, we scan it, the lower arch, the upper arch, and on the third, which is appeared to be blue, the scan body library or a scan body library is placed on the implant, and we get the complete information. And then we do the designing and articulation virtually. These are the different softwares of designing, and then we mill it and get the final outcome. Then we place the abutment in the patient's mouth. In the second picture, you can see it's the margins are exactly with the matching with the soft tissue, and we get the perfect occlusion. I think it's beautiful processes. Now, my latest love, which is known as, I called it a rising star, which is known as digital abutment also. So it has a different parts and they have a different functions, which we discussed now. So this is a digital abutment, and it will tell us about a lot of things actually. If you see, this is known as M25. They have different numbers. M25 means M is for molar, 2 is the collar height, and 5 is the post height, the abutment height. So they have notches on the proximal side of the abutment for the protecting cap, so that soft tissue doesn't flow in. If the soft tissue flow also, it doesn't make any difference to it, the abutment. So for premolar, they have a different kind of, in fact, for lower premolar, they have different digital abutment. For canines, for premolars, molars, for upper, they have different kind of digital abutments. So, and it is very easy to carry this digital abutment. They have a different armamentarium to carry it. And it's very easy to deliver the intraoral area. It only requires a driver. The carrier prevents screw from dropping into the patient's mouth. And I think this is very important. And once we place it, we can directly scan it. So in fully digital abutment, since they are utilizing a 3D CAD system, and it changes whole process and making process analog method. If the margin line is subgingival, it is hard to get as you can see in the first picture, if the margins are subgingival, it becomes very hard to get the accurate impression. That leads to the inaccuracy in the prosthesis. But if you see in a digital abutment, even if the margins are subgingival, digital process using a library system to make the ideal result. So it doesn't even require the gingival retraction cord, because since it has a scannable abutment, so it will give you complete information where exactly is the finished margin. So if it is in a subgingival also, the crown or the prosthesis will fit accurately. So these digital abutments come up with the adapters also, so that soft tissue grow around it, and we get the beautiful emergence profile. So it has a triple action. So it acts as a healing abutment also. It has a scan body, it acts as a scan body also, and for the final abutment also. So 3-in-1. So as I earlier told you that they have, for the different areas, they have different kind of digital abutments for the upper and lower, and depending on the cross sections. See, here we can see the cross section. So these cross sections are matching with the cross section of the natural tooth. So that's why they give you a beautiful emergence profile and beautiful final prosthesis. So they have a different parts. The upper part, which is a scannable, it's little rough, and it has a I will call it as scan adapter functions. And then we have a marking here like U25. This is for the upper central incisor, with the collar height is 2 mm and post height is 5 mm. And they have a protecting log grooves for protecting the cap. Then they have shoulder margins, depending on whether you are using a narrow connection or a regular connection. They have a different connections also. So it gives you a triple action: customized abutment, temporary crown, and scanner repair. Okay, so we'll see some cases which have collected for you guys. So we'll see one by one. So we'll start with a simple case. This is a case in which the patient has fractured forearm, and she's my friend, and she's radiologist by profession, since she is continuously in contact with the keep on talking to the patients. So it becomes very embarrassing for her to, if she had a missing tooth, and she wanted immediately. So we decided to go for a immediate temporization also. but I think nowadays this problem is solved because of the face mask we were using when we were talking. So, but at that time, unfortunately, she had to go for immediate temporization. So she's a 32 years old female with no medical problem. And the chief complaint was she had a fractured forebone, which was endodontically treated 10 years back. So again, to go for this computer-guided surgery, we have to take the intraoral scanner and a CBCT, and through that three-dimensional data, we are placed in a software, and we started designing the case virtually. So these are few pictures of CBCT when we are basically designing the case. And these kind of reports are sent to the clinician, and once they approve the case, and we go for the final 3D printing. Since we are going for a temporization also, so we started designing the processes also. So I decided to use a customized abutment rather than using a normal abutment, so that we get the perfect processes. So this is a fracture central incisor. So we have done the extraction using a magnetic mallet, which is a wonderful tool for atraumatic extractions. And after doing the extraction, we place the 3D printed guide on the patient mouth. And before going for a drilling, always check the fit of the guide. They created some windows on which you can see on the first picture, the right and left, there's a windows which you can see that whether this guide is fitted completely or not, because that can change the final processes. So these are the different armamentarium which I got through the DO implants. They have a customized abutment with a jig, surgical guide, temporary crown, and implant. So it's a full circle. This is a post surgery. On the right side, you can see we are placing an abutment with the help of jig, so that the orientation of the abutment will be perfectly placed. This is the immediate temporization, immediate after the surgery. Okay, so this is we have completed in 1 hour. So then we started practicing in implant also, which is known as tooth in an hour. So this is the second case in which the lady was wearing flippers for the last 7 years. Sorry, and but she's not happy with the flippers. Yes, they are a little mobile, and they are moving here and there, and she wants a permanent solution. But since she's using the flippers from last 7 years, there's severe resorption in the labial side of the incisors. So again, we decided to go for a computer-guided surgeries. And she's a 47-year-old female with no medical problem, but she had a missing 1-1 and 2-1 for 7 years. So virtually, after taking an intraoral scan and CBCT, we started designing the case, and we see all the orientation. If you see the picture, you can see the red circle and a green circle, and the safety zone around the implants. You can do it directly in the patient mouth, and in the lower pictures you can see the thickness of the soft tissue in the different areas, so that you can select the diameter and the height of the implant. And this is a pre and post implant surgery. You can see it's almost a bloodless surgery, and the patient was very happy. And after a few months, we placed the scan body in the patient mouth and scan the mouth. This is virtually after placing this library, the implant library of the patient's scan bodies. we started designing the case. Then the customized abutment, and virtually started designing the case. And these are given to us through this 3D printed models, and we transfer this prosthesis in the patient mouth. First we place the abutment, and then we do the final prosthesis. And patients were very happy since we got the fixed prosthesis after 7 years. So now we come to the third case. In this case, the patient had a missing 1-3 right from the beginning, and he had missing lower 6 also, 4-6 also. But I think here we'll discuss 1-3 because it's a very interesting case since the 1-3 was impacted in the patient's mouth, and it was very close to the vital structures. So we decided, and there's no prosthesis around the impacted tooth. So we decided to go for a implant. So patient was 40 years male, there is no medical problem, and he had an impacted canine. So this is the internal scanning of the patient. This is the occlusal view and this is the side view. Now this is a CBCT. As we can see, this canine on the 1-3 region, and it's very close to the vital structures, and I don't want to go for any surgeries, and even patient doesn't want to go for any surgeries since there's no pathology around the impacted tooth. So we virtually started designing the case, and after clinician approval, do the 3D printing, and some patient want immediate temporization. So we started designing the temporary processes also. So this is a within an hour again. We place the abutment and give the process immediately. See the soft tissue profile, beautifully done. So this is the last case which we are discussing, in which patient had a missing 1-4 and 1-6, and patient has some occlusal problems also. So we decided to go for a customized abutment, and we done the internal scanning. After placing the scan bodies, we did the scanning, and this was the implant gingival former in place with the 1-4 and 1-6, 2-6. It's long return. So after scanning, we have placed the implant library. Like if you see in the first picture, the library placed on the 1-6, and in second picture, the library placed on the 1-4. And then we started designing the case virtually. The designing of abutment, the designing of crown, and then we designed the abutments. And on the right side, you can see the orientation of the implant can be seen virtually. And with the help of this jig, we can place the correct orientation of the abutment. In fact, I've done this case last week only. So these are the customized abutment in place, and this is the final process. And patient is eating his food perfectly, and he's very happy with the kind of process he's got. And oh, there's one more case which we've done with a digital abutment, in which patient has a missing 4-6-4-7. So again, we have done collected the 3D data of the CBCT and intraoral scanning, that is data STL files, and they are missing 4-6-4-7. And after checking the fit of the right, we started doing the surgery. And this is a flapless case, replacing the implant, and we have placed the digital abutment. After placing this digital abutment, either we can put this cap, abutment cap, or we can give it temporary process also. So we decided to go for a temporary process. So this is a temporary process in place.
5 minutes to wind up your presentation, sir. Thank you.
Yeah, we are almost complete. So before ending my presentation, I would like to share one video, small video, which we done on behalf of IAD, which is known as Indian Academy of Digital Dentistry. So how a digital dentistry can change your practice. Thank you, friends. Here I finish my complete presentation, and I only request that you stay home, stay safe. Thank you.
And now, ladies and gentlemen, it's time for us to start with the question and answer session. We start with the first question, a question from Dr. Sachin. Dr. Sachin, so scan bodies are confined to that particular system only, and one scan body is adaptable at all sites and all sizes of that implant system being used.
Okay, so every system has a different scan bodies because they give you complete information, because every implant has a different internal connections. So they provide some scan bodies can be used like most of the Israeli implants have the same internal connections. So we can use the impact in the other Israeli systems, but most of the system, they have a different scan bodies. So whether they are narrow, whether they are regular platform, and they have different internal designing. So most of them have a different scan bodies.
Thank you, sir. Next question. Sir, where are these digital abutments available?
To the company, of course. But 3Shape providing some abutments which can be used in multiple systems.
Thank you. So friends, it's 3Shape to the person who asked, Dr. Archana. It's 3Shape. Please do get in touch with the respective company. What is magnetic mallet? Can you please explain?
Okay, magnetic mallet it's a you can say if you know the summer system, which we using a hand chisel mallets. So these are electronically designed, and here when we're doing it with a hand, we cannot control the force, and sometimes you apply a heavy forces, sometimes you're applying light forces, and these forces remains in the cranium for long period of time. But to control this problem, the Italian system have created a called a magnetic mallet, through which when we do the extraction, actually we go between the bone and a tooth, and they luxate the tooth and the tooth come out, and we can use it in a placement of implant, radiometric extractions, indirect sinus lifts, wrist plate, bone expansion. It has multiple functions.
Thank you, sir. Next question. So please explain about STL file and DICOM files.
मोटा मोटा तौर पे बताऊं, STL file you can see in which you can see the model, the picture in a model form, and DCM file you can see colors. Both dimensional files.
Thank you. Next question. How much does it cost to establish a digital implant clinic Which company 3D printer do you suggest?
3D print, eVision, and see, there are a lot of things, and according to your requirement, there's a huge line. You cannot discuss this thing in a small talk. It took hours to, to discuss about the 3D printing, even the milling machine, the software, the intraoral scanners. So it comes everything. So we have different kind of scanners, right from 5 lakh rupees to 35 lakh rupees. We have different scanners depending on your economy, your things you have to decide. Then whether you want to go for software, what kind of software you want to go for. You want to go for 3Shape software, you want to go for exopad softwares or different other softwares. Then the milling machines, you want to go for chairside or laboratory milling machines. You want to go for Emacs and zirconia, and they have different dry or wet milling machines. They have a different kind of 3D printings depending on their accuracy. Right from 75,000 rupees to 50 lakh rupees, they have different 3D printers. So, it's a
wide concept. Yeah,
wide concept.
Another 2 hours to complete the concept. And
exactly. You need a complete lecture on that.
Printing. So there was another question which said, how much is the cost to establish a digital implant clinic?
That's the same question, actually.
Okay. Again, a huge concept.
What kind of scanner you want to buy, which milling machine you want to buy, what kind of software you want to buy, what kind of 3D printer you want to buy. Again, that depends on.
All right, friends, definitely we would invite Dr. Sudhir to only talk about how to set up a digital implant clinic and what kind of armamentarium is required to set up a digital implant clinic. We move to the next question, doctor. How often do you use an ISQ device, the implant stability quotient?
I ask you to be very frank, I don't use much because I don't have it.